Hello friends, today's my discussion is on disorders of skeletal muscles. So first of all, what is myopathy? Myopathy, that is a muscular disorders in which dysfunction of muscle fiber leads to muscular weakness. Myopathy may be acquired or genetically derived, and this disease may or may not involve the nervous system. In this figure you can see very well these are a normal biceps, and in this muscular dystrophy these are a biceps muscle. Then common disease of skeletal muscles are muscular dystrophy, disease involving muscle tone, fibrillation and denervation hypersensitivity, myesthenia gravis, Lambert-EATON syndrome, mcardel disease, mitochondrial myopathy and nemaline myopathy. Now muscular dystrophy, that is characterized by progressive degeneration of muscle fiber without the involvement of nervous system. Mostly it has hereditary origin. The muscle fails to regenerate, resulting in progressive weakness and confinement to wheelchair. Eventually leads to death. Common type of muscular dystrophy are Duchenne muscular dystrophy and Becker muscular dystrophy. Duchenne muscular dystrophy, that is a sex-linked recessive disorder. It is due to absence of a gene product called dystrophin in the X chromosome. Dystrophin that is necessary for stability of sarcolemma. In this you can see the boy with Duchenne muscular dystrophy. You can see very well in their legs, muscles. This disease is characterized by degeneration and necrosis of muscle fibers. Degenerated muscle fibers are replaced by fat and fibrous tissue. Common symptom is muscular weakness. Sometimes there is an enlargement of the muscles, pseudohypertrophy. In severe condition, the respiratory muscles becomes weak and resulting in difficulty in breathing and death. Then Becker muscular dystrophy. Becker muscular dystrophy is also a sex-linked disorder and it occurs due to the reduction in the quantity or alteration of dystrophin. So in this figure you can see the Becker's muscular dystrophy. So early symptoms of the Becker's muscular dystrophy include walking on one's toes and frequent falls and difficulty rising from the floor. Then calf muscles may appear large and healthy as deteriorating muscle fibers are replaced by fat and muscle activity may cause cramps in some people. Then cardiac complications are not as consistently present in Becker's muscular dystrophy compared to Duchenne muscular dystrophy, but may be as severe in some cases. Cognitive and behavioral impairments are not as common or severe as in Duchenne muscular dystrophy, but they do occur. Common features of these disorders are slow progressive weakness of the legs, pelvis, pseudohypertrophy of calf muscles, difficulty in walking, fatigue and mental retardation. Disease involving muscle tone, hypertonia. Hypertonia or hypertonicity is a muscular disease characterized by increased muscle tone and inability of the muscle to stretch. Causes. Hypertonia occurs in upper motor neuron lesion, and during the lesion of the upper motor neuron, the inhibition of the lower motor neuron, gamma motor neurons in the spinal cord that is lost, and it causes exaggeration of the lower motor neuron activity and that results in hypertonia. In children, the hypertonia is associated with the cerebral palsy, means permanent disorders caused by brain damage which occurs at or before birth, and it is characterized by muscular impairment, and the motor pathway is also here affected, and such children usually have speech and language delays with lack of communication skills. Hypertonia and spasticity. Hypertonia may be related to spasticity, but it is present with or without spasticity. Spasticity is a motor disorder characterized by stiffness of the certain muscles due to continuous contraction. Hypertonicity is one of the major symptoms of spasticity. Paralysis means the complete loss of function. So paralysis of the muscle due to hypertonicity is called spastic paralysis. In hypertonia, there is a resistance to passive movement and it does not depend on velocity, means the speed at which the movement occurs. Whereas in spasticity, there is an increase in the resistance to sudden passive movement. It is the velocity dependent, means faster the passive movement, stronger the resistance. Hypotonia. Hypotonia is the muscular disease characterized by decreased muscle tone. The tone of the muscle is decreased or lost. Muscle offers a very little resistance to stretch. Muscle becomes flaccid and the condition is known as flaccidity. Then what are the causes of hypotonia? So, major cause for the hypotonia is lower motor neuron lesion. The paralysis of the muscle with hypotonicity is known as flaccid paralysis and it results in wastage of muscle. Hypotonia may also occur because of the central nervous system dysfunction, genetic disorder or muscular disorders. Clinical conditions associated with the hypotonia are Down syndrome, chromosomal disorder characterized by physical and learning disabilities. So in this image, you can see here the signs of hypotonia and so hypotonia in children. Then what are the signs? So in supine position like frog position and their heads, leg when they are held up and they slip through at the shoulders and do not stand upright on their legs and form inverted U shape in ventral suspension and lie flat when in prone position. Here the signs of hypotonia. So ventral suspension. So inverted U position. Then the back hangs over the examiner's hand and the limbs and head hang loosely and the passive extension of legs and pull to sit head leg. So you can see here the inverted U shape and here the decreased muscle tone hypotonia. Then this is an image of Down syndrome. So here you can see flat nasal bridges. Here there is a no flat, here flat nasal bridges. Then nuchal folds. Then here single palmar flexion crease. And there is a decrease in muscle tone, hypotonia. Then clindoclyteal of the fifth finger. Then upslanted palpebral fissures. Okay. Then second is myesthenia gravis, kernicterus, and congenital cerebral ataxia means there is a incoordination. Now in kernicterus means there is a brain damage caused by jaundice in infants, means there is a accumulation of the bilirubin in the basal ganglia, that is known as kernicterus. Then muscular dystrophy, then congenital hypothyroidism, hypervitaminosis D, rickets, infant botulism, in which paralysis due to botulinum toxin. Now myotonia. Myotonia is a congenital disease characterized by continuous contraction of the muscle and slow relaxation even after the cessation of voluntary act. The main feature of this disease is the muscle stiffness, which sometimes referred as cramps. And here the muscle relaxation is delayed. So in this picture you can very well see the myotonia. This type of the muscular stiffness with delayed relaxation causes discomfort during simple actions like walking, grasping and chewing. The muscles are enlarged. There is a hypertrophy because of the continuous contraction. Myotonia sets in during early to late childhood and it is not progressive. Then what are the causes? So myotonia, that is caused by mutation in the gene of channel protein in sarcolemma, and such disorders are known as channelopathies. Myotonia is of two types: Baker type myotonia or generalized myotonia, which is more common than Thomson type myotonia, and it is an autosomal recessive disorder produced by defective genes contributed by both the parents. Thomson type myotonia is relatively very rare and it is an autosomal recessive disorder produced by the defective gene contributed by one parent. Then fibrillation and denervation hypersensitivity. Denervation of the skeletal muscle causes fibrillation with flaccid paralysis and denervation hypersensitivity. Fibrillation means the fine irregular contraction of the individual muscle fiber. Here you can see the fibrillation of the atrial muscles of heart. Then denervation hypersensitivity. After denervation, the muscle becomes highly sensitive to acetylcholine molecule, which is released from the neuromuscular junction, and it is known as denervation hypersensitivity. So here that is a acetylcholine molecules, and these are the acetylcholine receptors, and gates are open. Then myasthenia gravis. Myasthenia gravis, that is a autoimmune disease of neuromuscular junction caused by the antibody to cholinergic receptors. Myos means muscle and asthenia means weakness. So it is characterized by the grave weakness of the muscle due to inability of the neuromuscular junction to transmit the impulses from the nerve to the muscle. And it is a serious and sometimes a fatal disease. Then what are the causes of myasthenia gravis? It is due to development of the autoantibody immunoglobulin G against the receptor of the acetylcholine. That is, the body develops an antibody against its own acetylcholine receptor. This antibody prevents the binding of the acetylcholine with its receptors or destroy the receptors. So though the acetylcholine release is normal, it cannot execute its action. Symptoms. Muscles which are more susceptible for the myasthenia gravis are muscles of the neck, limbs, eyeball and the muscle responsible for the eyelid movements, chewing, swallowing, speech and respiration. Common symptoms of the myasthenia gravis are slow and weak muscular contraction because of the defective neuromuscular activity, inability to maintain the prolonged contraction of the skeletal muscle, quick fatigability when the patient attempts to repeated muscular contraction, weakness and fatigability of arms and legs, double vision and droopy eyelids due to the weakness of the ocular muscles, difficulty in swallowing due to weakness of the throat muscles, difficulty in speech due to weakness of muscles of the speech. In severe condition, there is a paralysis of muscles and patient dies mostly due to paralysis of respiratory muscles. Then what is the treatment of myasthenia gravis? Myasthenia gravis is treated by administration of the choline esterase inhibitors such as neostigmine and pyridostigmine. These drugs inhibit the choline esterase which degrades the acetylcholine. So the acetylcholine remaining in the synaptic cleft for long period can bind with its receptors. Then Lambert-Eaton syndrome. Lambert-Eaton syndrome, it is a disorder of the neuromuscular junction caused by the development of the antibody against the calcium channel in the nerve terminal, and that results in the reduction in the release of the quanta of the acetylcholine. And this disease is commonly associated with carcinoma. So it is also known as carcinomatous myopathy. And this disease is characterized by the several features of the myasthenia gravis. In addition, the patients have a blurred vision and dry mouth. Then McArdle's disease. McArdle disease is a glycogen storage disease, means the accumulation of the glycogen in the muscles due to mutation of the gene involving the muscle glycogen phosphorylase. Then what is the function of the glycogen phosphorylase? That is necessary for the breakdown of the glycogen in the muscles. Muscular pain and stiffness are the common features of this disease. Mitochondrial myopathy. Mitochondrial myopathy, that is an inherited disease due to defect in the mitochondria of the muscle fiber. And mitochondria, that is a critical source of energy. Then what causes the mitochondrial myopathy? Mutation in the gene inherited from the family. Now myo means muscle and patho means disease. So it is a muscle disease. Symptoms: neurological and muscular problems, muscle weakness. So exercise intolerance, hearing loss, trouble in balancing, seizures and learning deficit. How does the mitochondrial myopathy work? So mitochondrial myopathy occurs when the mitochondria is unable to create enough energy for the body and therefore causes the person to feel lethargic and weak. The mitochondria is the part of the cell that is in charge of creating energy or ATP from the carbohydrates or fatty acids in the food we eat. Because the energy from the mitochondria are highly needed in nearly all the cells in the body, and having a deficiency of it can affect the tissue and organs as well. So in this image, that is a chronic progressive external ophthalmoplegia and ptosis. The ptosis evident and the lack of the eye movement demonstrated when the patient was asked to look up. In A figure, the patient is asked to look up, then to look left in B, then to look right in C, and to look down in D. So both indicate the presence of a mitochondrial disease. Then treatment. Though there is no real treatment or a cure, physical therapy can help with symptoms along with the vitamin therapies. Change in the diet. Then nemaline myopathy. Nemaline myopathy, that is a congenital myopathy characterized by microscopic changes, and there is a formation of the small rod-like structures in the muscle fibers, and it is also known as nemaline rod myopathy. The features are delayed development of the motor activities and weakness of muscles. So what are the symptoms? There is a proximal muscle weakness, hypotonia, decreased deep tendon reflexes, feeding and respiratory difficulties, facial and bulbar weakness, and respiratory muscle weakness. Then electromyogram. So what is the electromyogram? Now electromyography, that is the study of the electrical activity that occurs in the muscle, and electromyogram, that is a graphical registration of the electrical activities of muscle. Electromyographic technique. So cathode ray oscilloscope or polygraph, that is used to record the electromyogram. Two types of the electrodes are used for recording the electrical activities of the muscle. First is surface electrode and second is needle electrodes. Surface electrode or skin electrodes for studying the activity of the muscle, and needle electrodes for studying the electrical activity of single motor unit. Then what is electromyogram? So structural basis for the electromyogram is the motor unit. Electrical potential developed by the activation of the one motor unit, that is known as motor unit potential, and it lasts for about 5 to 8 milliseconds and has an amplitude of about 0.5 millivolt. Mostly it is monophasic. Electrical potential recorded from the whole muscle that shows smaller potentials if the force of the contraction is less. When the force increases, larger potentials are obtained due to the recruitment of more and more number of the motor neurons. Then what are the uses of electromyogram? That is useful in the diagnosis of various neuromuscular disease such as motor neuron lesion, peripheral nerve injuries and myopathies. That is a electromyogram during alternate contraction and relaxation of biceps muscle. Thank you very much.